Hello, my name is Casey Jones. I'm a student at Florida Gulf Coast University in their exercise science program. For this spring semester at my experiential learning site called HealthFit, powered by Sarasota Memorial, located in Sarasota, Florida, I worked with a class known as the Bone Builders. The Bone Builders is a supervised exercise program designed to fight bone loss due to osteoporosis. Osteoporosis is a skeletal bone disease that is due to low bone density that makes bone very porous and soft. These patients can be susceptible to fractures in the hips and the knees, and this is most common in postmenopausal women and men over the age of 50. The goal of my project is to analyze the effects that resistance training has on osteoporosis patients, and I chose this project because I was very interested in the exercise guidelines and working with these patients in a resistance training program. Upon shadowing the Bone Builders class, I began doing research on the topic and analyzing the disease. I reviewed many different exercises to help improve bone density. I utilized peer-reviewed journals, YouTube videos for different osteoporotic exercises, and also the ACSM guidelines for exercise testing prescriptions on osteoporotic patients, analyzing the fit recommendations for resistance training, and also reviewing the contraindications for training with these populations. For my literature review, I analyzed a journal done by the Endocrinology and Metabolism Journal that reviewed the effects that resistance training has on osteoporotic patients. This study found that resistance exercise is known to be highly effective and very beneficial to the preservation of bone and also muscle mass. In this journal, they also noted that mechanical loading is a fundamental factor in improving bone density. This study found that performing resistance exercises 2 to 3 times a week for a year demonstrated maintenance in bone mass density in postmenopausal women. This helps give credibility to my project by giving facts about mechanical loading and how they benefit osteoporosis patients, and also by working with a population that is very common with the disease, postmenopausal women. In another study done by Medicine and Science in Sports and Exercise Journal, they performed a study on comparing eccentrically focused resistance training exercises to concentrically focused resistance exercises on knee osteoarthritis and osteoporosis patients. There were 90 participants who were randomized in either an eccentric resistance training group, a concentric resistance training group, and a no exercise group. They utilized machines that helped overload the muscles either eccentrically or concentrically, such as the leg press or leg extension. Both concentric and eccentric resistance training groups found that 16 to 28% in improvement and bone density. The rate of weekly strength was found higher in the concentric resistance training group, and this helps to apply to my projects because in my class, the Bone Builders, we often use machines to help overload the bones and muscles to help promote bone growth. But we never analyzed the effects that eccentric or concentric resistance training would have a different impact on the patients. In another article that I analyzed, a study done by the American Study of Bone Research, they analyzed the effects that a high resistance training and impact training would have on osteoporosis patients. This program did a lift more trial on postmenopausal women with low bone mass over an 8-month period. But there are also very many safety concerns to be aware of when doing high impact training on osteoporosis patients with porous bones, such as fractures in hips and knees, and also balance issues that could promote fractures. And this is very applicable to my site and the class that I worked with because we worked with a similar population, which in my class we worked with about 80% women who were postmenopausal who were suffering from osteoporosis, but we never looked into a high impact or a HIIT training type of approach to resistance training for these patients due to the risk. In a journal by Bodywork and Movement Therapies, they looked at the effects that resistance bands have on promoting bone growth for these osteoporosis patients. They worked with 60 postmenopausal women who suffered from osteoporosis who were guided through supervised Pilates. At the end of the study, the women improved their quality of life, their 6-minute walk test, their sit-to-stand assessment, and this helps support my project by providing information that exercise is in fact medicine and that resistance training can help promote bone growth in postmenopausal women and osteoporosis patients. So unfortunately, my site got cut a little bit short at HealthFit due to COVID-19. So now I'm going to provide an at-home look at some of the stuff we did in Bone Builders and an osteoporosis home workout. So the fit recommendations for an osteoporosis patient for resistance training is to start with 1 to 2 non-consecutive days a week of resistance training and then progress of 2 to 3 days per week. The intensity should be high intensity training is beneficial with mechanical loading to help promote bone growth, and the last 2 repetitions of the exercise should be somewhat challenging to these patients. The time of the exercise should begin with 1 set of 8 to 12 repetitions and then increase to 2 sets and then increase the repetitions as well. The type of exercise can be any standard equipment. When you're at a gym setting, you can use just any type of free weights, any type of dumbbells, barbells. You can also use weighted machines, stuff like that, under supervision, of course. So some of the contraindications to resistance training with osteoporosis is don't do any maximal muscle strengthening, because this could put a lot of stress on the bones and promote a fracture. And also no balance risk assessments, because they could fall and then be susceptible to a fracture as well. So for today's resistance training program, we're going to look at a lot of exercises to help strengthen the hips and the knees, because that's where a lot of the most fractures are in osteoporosis patients and could be detrimental. So today we have a client posing as someone with osteoporosis, postmenopausal female with osteoporosis here. She's currently warmed up, did a brisk walk and stretched the muscles out that we're going to be utilizing, most of the hip abductors and knee flexors and extensors. So we're going to get into the first exercise, which is going to be chair sit to stands. Basically going to be a safe squat. We're going to make sure the knees don't go past the toes. We can also have a chair here, a cane for support if there's any type of balance issues. This is going to help strengthen the knee and the hip flexors. This is a great exercise for osteoporosis patients, mechanical loading. So this is perfect. We're going to do 3 sets of 10 of these, and then we'll move on to the next exercise. So for the next exercise, we're going to be having the client do these chair lunges, hands supported on the chair, lunging out. We're going to be doing 3 sets of 10 on each leg, making sure the knee doesn't go past the toe, nice tight core and neutral spine. This is great for the quads and the hamstrings, and this is perfect for mechanically loading the femur, tibia, and fibula, stuff like that, to help promote bone growth in those areas. Perfect. Now for the next exercise, we're going to be doing some banded hip abduction work. So we're going to have the client step in the band, feet about shoulder width apart, a slight bend in the knees, and the higher you pull the band up, the more resistance you'll have when going laterally. So you're going to want to step out, step back. You're just doing abduction of the hip. This is going to work the glutes and the hip abductors. So this is a perfect mechanically loading, great hip exercises for osteoporosis patients. So we're going to do 3 sets of 10 of that. Alright, for this next exercise, we're going to be doing step-ups. So if you have like a step or a small ladder at your house, you can do this. We're just going to have the client step up with 1 foot onto the ladder and then step down, making sure to have some sort of support just in case of fall. So this is a perfect exercise, great mechanical loading, working the hips and the knees. Perfect. And also with any of these exercises, if you feel any type of pain or discomfort, just stop doing the exercise. We can modify anything for you. Perfect. Alright, for the next exercise, we're going to be doing these banded hip thrusts. So we're going to have the client flat on the ground. We got the band across the knees here. And we're going to try to bring the pelvis up as high as we can, extending the hips. Perfect. This is going to work the glutes, quads, hamstrings, anything like that. And this is a great movement, strengthening the bones and the muscles of the hip, which is very important in osteoporosis patients. Nice deep breaths. Good. Neutral spine. Perfect. So we're going to do 3 sets of 10 on that one, and then we're going to roll over. We're going to do some clamshells. So we're going to be laying on our side here, knees even, and then we're just going to open and close, abducting the hips, strengthening the bones, the femur, and also strengthening the glutes and the hip abductors here. So we're going to do 3 sets of 10 on each side, and then we'll roll over and do the other side. Some things that I would do differently when working on this project is having more one-on-one time with these osteoporosis patients, and also having a more diverse level of osteoporosis within these patients. I am also curious on whether or not high-impact training and HIIT training is more beneficial in the long run with these osteoporosis patients, and if the benefit outweighs the risk. I have learned a lot about osteoporosis and resistance training in these patients, and I thank you for this opportunity.